name is Raymond Bila. I'm the CEO of Helen Joseph Hospital based in Auckland Park. I was at this IT summit in 2015, and that's when I heard about technology that is available to improve performance in healthcare management. I had a chance to speak to somebody from SEP, Shamin Odendal, and we spoke about the challenges that we have about managing data or managing my office so that I have data that I can use to improve performance in the hospital. It took more than a year of to and froing talking to them, and ultimately we started having discussions, and I discovered through them that actually the step that we have in the province is e-governance that is also using the same one. So then we got someone to come to the hospital, and they managed to help us to put together a program. They downloaded a program on our computers that we can use to manage information for IT, from patient administration, from finance and HR. So we're working on that so that I can improve performance, I can have up-to-date information about what is happening in the hospital. When I heard about this conference this year, I decided to come back so that I can learn more about how I can improve the hospital efficiency. One of the problems that I have is about managing irate members of family members when they bring their family members to the hospital at the emergency department. And so now I've spoken to quite a number of people who will say that they can work with me to provide a solution, so we can update members of the family members about what is happening at the emergency department with the patient. The members is being seen by the doctors at ED. And I hope that after this conference, those people will be with me and will talk about the solutions that will help me with that problem that we have at the hospital.
Lenox Labbe, Head of IT, Barr, South Africa. We came here to this conference on the back of making a promise, a commitment rather, last year, where we said if we cannot collaborate and bring out some type of initiative, a collaborative initiative, to talk about this year, it wouldn't be worth coming back. Obviously, I'm back this year because we were able to get some form of collaboration working, where we were able to get our Angels initiative talking to a partner that we came into contact with here at this conference last year in 2016. And what that allowed us to do was to basically piggyback off the back of them to implement stroke centers with the protocol out of our Angels Initiative program.
My name is Dr. Sushant Palais. I'm the Sales and Marketing Executive at Meditech South Africa. Meditech, we're a healthcare information systems company. We deploy solutions that pretty much look after all aspects of the care continuum. I think this event is great. It brings in the various stakeholders in the healthcare industry. It's all about innovation, it's all about disruptive technology, it's all about digital health, and I think this platform is great. Sharing of ideas, dialogue, debate. Yeah, it's a great event to attend to.
Hi, my name is Dr. John Morrison. I'm a clinical user experience specialist based in London, and I've really loved my time here in Johannesburg. It's the first time I've been to one of these conferences. It's been a great opportunity to connect with like-minded individuals that are really passionate about digital health and transforming the way we provide healthcare services here in South Africa. And I'm really keen to come back next year.
My name is Andrew Brown. I am the Managing Director of MediSwitch, and I've thoroughly enjoyed the event today. We've heard from speakers who are really challenging the status quo of the adoption of technology and health technology in the healthcare market in South Africa and in broader Africa. And I firmly believe that events like this brings all of those role players together, and it challenges each one of us to think about what we do on a day-to-day basis differently, so that we can actually go out there and ultimately make a difference to health in Africa and in South Africa.
My name is Dr. Cipolla. I come from a company called What If Health. What If Health is in the business of developing clinical softwares for non-communicable disease, re-engineered primary health care, where we do immunization, antenatal care, HIV and AIDS and TB treatment protocols. Yeah, I was very impressed with this conference because we covered a whole lot of topics that I think pertinent to the kind of work that I do. And I was impressed by the fact that everybody now is coming to realize that to deliver most effective applications that will be of assistance to patients, we need to start thinking interoperability. And that for me was actually the best that I could take from this conference.
Hi, I'm Mike Simpson from a company called Imperial. We're focused on advancing imaging healthcare through the use of technology, thereby bringing healthcare to the people of Africa and beyond. The event has been awesome, got great response, and with the launch of our artificial intelligence for TB, it's been great interest. For the rest of Africa, this is definitely an event to attend, as all industry leaders, decision makers, policy makers are in attendance.
I'm Mandy Barr from Western Cape Health Department, and I do strategic partnerships between public and private sector. And I really love the conference because it's relevant. It talks about all the hot topics and the things that we should be focusing on if we ever want to work better together between public and private.
I'm JP from Kisara Document Solutions. I'm the product manager. This event in particular is very important for us to understand the technology of the healthcare industry and also how we can drive trends and innovation through this. The importance around this is how do we make the life better for industry but also for patient and care.
Hi, my name is Elliot Sack and I'm CEO and founder of eHealth Group. We're an innovative healthcare and digital technology company that provides medical services to various types of clinical environments across the continuum of care, from high acuity hospitals to primary clinics. And what we're doing is implementing systems that are going to improve healthcare delivery globally through a cloud infrastructure. And I think that this Innovation Summit has been truly intuitive. We've learned a lot and we're excited about participating in this event.
I'm Dr. Rajiv Ishwari. I'm the Director eHealth for KwaZulu-Natal Department of Health. And so far it has been good and quite informative. And I've been able to network with a lot of people in the same space.
Hi, I'm John McLaughlin from J2 Software. We're here to discuss how visibility brings about reduction of risk and improves your security posture. So we provide our customers with ongoing vulnerability assessments overlaid with threat intelligence, so you can react to real-time threats. We can't stop everything. It comes about that the ability to react immediately is what will save you. At this event so far, things are going really well. We had some really meaningful discussions and conversations, and people understand that cyber threats are on the rise and there's no ways that they can do it themselves.
My name is Joe Stratham. I'm an IT consultant, currently working as a consultant as part of the commissioning exercise that we're doing at the Nelson Mandela Children's Hospital. So 2.5 years ago, the building was handed over. And when I say that building was handed over, you walked inside the building, dodging dagga and exposed pieces of masonry. So a group of 7 people, which made up the commissioning team, which comprised of a number of specialists. I was responsible for ICT, so anything that had to do with computers was in my area of responsibility. And 2.5 years later, the hospital is fully commissioned, and we're very proud of it. In terms of the session that we had, I found it to be very informative. The speakers were very, very high quality, and it was also, I think, quite nice to see people from government partaking, because they normally get nailed by the private sector, but there was a spirit of cooperation and all the rest of it. So all in all, lovely event.